First, schools are under a lot of pressure these days, trying to improve learning, but also dealing with more and more of our social and even family problems.
It has become a burden for them, and school leaders in one Maine county are sounding the alarm. 207's Don Kerrigan is here with more on what's happening. Don?
Yeah, and this is, of course, is a problem all over Maine, but we're talking specifically about Knox County, which is one of the most attractive and popular tourist areas of Maine, but also home to thousands of families, some of whom are struggling. And school leaders say those struggles more and more are showing up in the kids. They say it is a growing challenge for the schools, and as a result, schools are getting close to a breaking point. What's happening in Knox County schools? Ask Jessica Berry, Special Ed Director for the small school district in St. George. She talks about students with real problems.
Have been coming in with these really sad, intense stories of neglect and abuse, and then they are reliving that trauma and acting that out at school through aggressive means. That breaks down your educators because they have become the mental health providers and the crisis workers.
We talked about it with Berry and Superintendent Mike Felton. They say schools have become overloaded dealing with mental and emotional health needs of their students.
When I started this job in 2015, 12% of our school's budget went to special education. This year, 21% of our budget is going to special education. When I started, we had 1 special education teacher and 2 special education ed techs. This year, we have a special education director, 5 special education teachers, and 10 special education ed techs.
And this school only has a little over 200 kids.
So just over that short period of time, we've seen a huge influx of students with severe social, emotional, mental health, and behavioral needs.
They say all the area schools are feeling the same pressures. So Jessica Berry and other special ed directors called a public meeting in Rockland. They expected 20 or so people. 200 showed up. School leaders from all over Knox County, concerned parents, healthcare providers, and others, all to hear the schools plead for help.
I think the core of the problem is that our families are under a tremendous amount of stress, and those stressors are getting their mental health needs met, putting food on the table, housing, a variety of services. There's the opioid epidemic. There's just a tremendous amount of stress coming in on those families.
And they say it's all showing up in the kids and the schools. How is this manifesting itself in the school? What are you seeing?
Yeah, I mean, I think, what we see is more extreme behaviors from younger and younger students. A reality is that, we've had teachers go home with bruises. On a too regular basis. And those are teachers who are working mainly with K-5 students.
Healthcare providers say they see it too.
It's heartbreaking to watch these kids go from, infants to toddlers and to sort of be able to see it coming, but not be able to intervene at the level that we need to.
Rachel Wilcox is a pediatric nurse practitioner at Penn Bay Hospital.
Emotional outbursts, physical outbursts, aggression, getting kicked out of a daycare situation because they can't, access their regulatory skills because they're constantly in fight, flight, or freeze, and it's impossible for them to do anything else.
And without enough treatment and help, when the kids reach high school age, those problems can become worse.
I think our whole community is in crisis.
Joseph Huffnagel runs the Landing Place in Rockland, a program that tries to help teenagers. He says the problems come from what kids face at home.
What I've seen is that there's a greater willingness for youth in the last few years to be asking desperately for help, and us not being able to provide that support, that level of support, whether it's therapy, whether it's counseling, the basic needs support we could help to some extent, but then we often have to send youth home to living situations that aren't safe or stable.
These 4 all say the schools and families need more support. Housing, food, childcare, mental and emotional counseling and treatment, but they say that too often there just isn't enough help to meet the need. So do most of us think that just assume all of these services are out there if people only ask, and they really aren't out there?
I think that's very true, is that there is an assumption that these services are readily accessible and given freely, and they're not. you know, there's very limited resources for therapy or counseling to even be able to refer the family of the 3-year-old who's asking me, how do I parent this child? What do I do to support their needs?
This group says the area can and must find solutions.
It's not all a sad story. We see on a regular basis through the efforts of our educators and other service providers, kids' lives turn around. Like working in partnership with their families to make sure the child gets what they need, that they can go from kicking and screaming and biting to reading and writing and caring for one another. And that's what keeps all of us going in this profession.
They say the whole county needs to pull together, schools, healthcare, government, and local people, to provide more help for families to raise more stable kids, and say it needs to happen soon. There's obviously a lot to this, and it's not going to be fixed overnight. The members of this group say their next steps include getting some research done from the University of Maine in the short term, and also trying to pull together some kind of organization that could better coordinate all the services and work with families and schools to help ensure that those services are put out there. The Maine Department of Education told us that they were present at that initial meeting and that they continue working with the members of that group. And as they said, this is Knox County, but obviously schools all over Maine face these challenges, so it's a big issue.
Yeah.
Sure is. Thank you, Don.